Hi, this is Angela Bates, registered nurse. This is a community analysis of Pinellas Park, Florida. The Pinellas County area has been inhabited for 12 to 14,000 years. The earliest known inhabitants were a tribal people known as the Paleo Indians. Sea levels were much lower then. Thus, the Florida coastline is estimated to be about 200 miles west, according to PinellasCounty.org. Some of the Native American tribes that lived in this area were the Tocoboga and the Seminole tribes. In 1890, F.A. Davis, who was also a publisher from Philadelphia, came to Pinellas County and saw an opportunity to develop Pinellas. F.A. Davis purchased 12,800 acres in 1911. It was known as Pinellas Farm. Pinellas Park was developed at the time to grow sugarcane. F.A. Davis built the Colony House, which housed rich visitors to the area and held social gatherings, hoping to entice people to this area. The train station was built in 1912, which brought Northerners to the area. Pinellas Park was a very bustling community. It established its own newspaper, hotel, telegraph, and post office, its own school, library, and city hall. By 1915, Pinellas Park had 250 acres of planted sugarcane and had Florida's largest sugarcane syrup plant. Pinellas Park was mostly a small agricultural community until 1969 when the area grew commercially because of the major roadways that were built through Pinellas Park for tourism in Pinellas County. Pinellas Park sits on approximately 17 square miles, centrally located in the heart of Pinellas County. According to the City of Pinellas Park, there are about 52,400 residents who enjoy a diversified economy based in educational services, healthcare, and social assistance, as well as retail and manufacturing. Pinellas Park is structurally balanced by meeting the needs of citizens by education, housing, recreation, transportation, access to medical care, commercial and community resources for a city this size. Pinellas Park has approximately 24,000 residential houses that are mostly comprised of single-family homes. According to the City of Pinellas Park, the homeowners make up about 65% of this residential areas, but poverty is at about 15% in Pinellas Park. The median income is 41,000. Some of the rental homes, there are some rental homes, and then there's some townhomes, apartments, and condos as well. Rent averages around $1,000 a month. Public schools are good in that community. There's 5 elementary schools, 5 middle schools, one public high school, and there's also the St. Pete College Health Education Campus, as well as a few vocational training institutions. There's not a lot of healthy options for restaurants in Pinellas Park, but there are a lot of fast food options. And there are a lot of options for grocery stores, Publix, Walmart, Winn-Dixie, and Aldi's. Some of the commercial shopping leads a little to be desired. And there are several vacant shopping centers that have been on the market for a long time. And these areas could be developed for additional housing or businesses that would bring more growth to the area. There are a few concerns to be noted about the population of Pinellas Park. According to the U.S. Census Bureau info, it has a higher percentage of people living in poverty. 15% of Pinellas Park is living in poverty, and Pinellas County itself is only at 11.7%. Pinellas Park also has a higher percentage of persons under the age of 65 living with a disability at 13.7%. And again, Pinellas County is at 9%. So Pinellas Park is a lot higher than the county average. Only 20% of Pinellas Park citizens have a bachelor degree or higher education, as opposed to 31% in Pinellas County. A study done by Montez and others showed that having a low level of education presents a much greater risk of disability, and high levels of education seem to provide some kind of protection against disability, probably because you're living a healthier lifestyle. Higher educated people appear to utilize their resources better. They avoid disease, disability, and death. The city of Pinellas Park government is very progressive. They operate under a council manager form of government. They have about 515 employees that meet the needs of the residents and businesses. There's 5 total council members, including the mayor and vice mayor, and they are very open and available to the public. They have regular meetings, council meetings, and they're open to the public. And they're very involved in the community, getting the community's participation for public policy. They recently did a needs assessment to find out what some of the community needs were. Some of the ones that were identified was, more affordable housing. And they also noted that some of the homes in the city were over 40 years old and needed repair, so they came up with the community development and redevelopment programs. Pinellas Park is centrally located. There is really not any healthcare access need because everything is really just a stone's throw away, and there is sufficient healthcare clinics and hospitals in the community that are very close by if they're not within the city walls. The closest acute care hospitals are Northside and St. Pete General, which just border on the southern border of Pinellas Park. There are urgent care and primary care clinics inside Pinellas, as well as CVS and Walgreens pharmacies. There are several centers for the elderly, skilled nursing, assisted living, and there is some home health care agencies. Unfortunately, with home health care, though, you do have to private pay for most of that unless you've got some kind of long-term care insurance. And so unfortunately, a lot of the home health is private pay, which most senior citizens cannot afford on a fixed income. The mental health center, there is an acute inpatient hospital. There's one inside of Pinellas. And then there are some other community-based, and they accept Medicaid and Medicare for mental health care inside of Pinellas Park City. They also have the Neighborly Care Network, which provides some elder transportation and Meals on Wheels services. Here are 3 of the Healthy People 2020 objectives that I chose for this community. The first one is to reduce the proportion of adults with obesity. All of these are citations from the Healthy People 2020 website. The rationale for that is many adults in the United States have obesity, which is linked to chronic diseases like type 2 diabetes, cardiovascular disease, and several types of cancer. Obesity-related stigma and discrimination can also lead to other health disparities. The other one, second, is the to reduce the overall cancer death rate. Cancer is the second leading cause of death in the United States. There can be strategies to help people quit smoking, eat healthier, and get more physical activity, which can help reduce death rates from different types of cancer. Number three, reduce the proportion of people who have alcohol use disorder in the past year. According to the Healthy People 2020, drinking too much alcohol can cause serious alcohol problems, including stroke, cancer, and cirrhosis. Pinellas County has a very healthy environment. Some of the city's services to help keep things safe and running smoothly. They have a very safe streets. They've got a community police force who believes in community policing, fire departments, curbside recycling, and trash pickup. They also have 19 parks and several recreation centers, one with a pool. They have adult fitness centers inside of them that if you are a member, which is very reasonable, $5 a year, you can use their adult fitness center. They also have a variety of classes such as cardio drumming, martial arts, painting, and they also have summer camp and after school care for children. Another thing they have is for the city library, it's 31,000 feet of square foot. So the other thing they also have is they have a very busy, very big equestrian community, and they have rodeos and horse shows, as well as many private stables, which, this area was very agricultural and sort of country-ish, which I think is kind of charming. So these are the six community needs that I identified and prioritized using Maslow's hierarchy of needs. The first one would be food insecurity. There are two distribution sites that offer breakfast and lunch for children 17 and under. This doesn't include elderly or adults. And then the Neighborly Network has a senior cafe that provides free lunch to age 60 and older every day. And that doesn't address children or adults. So there's not a lot for the adult population to address food insecurity. The second would be housing. Just in general, there's not a housing authority. And so they do have a very high Section 8 waiting list. And a lot of according to the Pinellas County Consolidated Plan, more than 60% of the homes are more than 40 years old, and have a lot of maintenance needs, such as roofs and energy upgrades. The next one would be for obesity and diabetes. The According to Parker and others, the health implications of obesity and sedentary lifestyles are broad and associated with diabetes. They did a study that was published in the Community Health Journal that brought all community partners together, and they applied for a grant through the Tennessee Health Department. And basically, they did community health educational sessions. They did coordinated fitness and nutrition programs, and they built some community fitness trails. This all had a very good impact on the community. It promoted a culture of wellness, and they had a lot of really good outcomes, and that was highly recommended. The next would be environment modification for the disabled. Both for in-home availability for disabled populations that were in poverty. I don't. There's not really a lot of. There is some funding through the city, but that would be something that would definitely help for the security and safety of disabled. Next would be the cancer. As we live in Florida, and there is high risk for skin cancer, as well as tobacco use is very prevalent. And there's a lot of smoking, and that does cause cancer. The next would be the very last one I picked was education, just because, as stated earlier, the having a higher level of education does offer some protection from, diseases and poverty. So maybe, having a bachelor's degree in higher education promotion would be a good thing for Pinellas Park. Pinellas County has done a really good job of keeping our COVID-19 numbers down. Most employers are screening their employees, as well as they have several testing sites. They are asking people to quarantine, and then they have the masking laws. Pinellas County overall is very low as of yesterday, the 29th. This is the data here. And as in Florida, we were way up there, but Pinellas County has done really well at keeping the numbers down.